At the beginning in Takum, we had a very good mission hospital during the missionary time. But after the crisis in Takum, we had no place where our people should give birth to their children, and that brought about much or many problems to Takum.
There was not any hospital per se that is functioning very well in the whole state.
1,000 pregnant women are dying.
Taraba State is a very big state, and we have received patients from not only Takum Local Government and the 2 surrounding local governments, but from 9 local governments, even up to 300 kilometers away from this hospital, have come for treatment. We've also had patients from neighboring Benue State, and we've even had several patients coming from across the border in Cameroon.
The coming of the hospital, I can now tell you tentatively that most of the communities around, they have no problem again.
The vision of this facility was basically to reduce infant mortality in Nigeria, which has one of the highest infant mortality rates in the world.
Since the maternity hospital was commissioned in December 2017, it was a state-of-the-art hospital.
The laboratory provided by Governor Ishak, we are very grateful.
And the twin building for the doctor's quarters, which is fully funded by the executive governor.
We treat basically pregnant women and children that are less than 5 years. Most children that are less than 5 years come down with anemic heart failure and severe malaria, of which an emergency blood transfusion is most often required.
The hospital had all the equipment it needed. It had all the doctors it needed, surgeon, physician.
First year of operation at the Rufkatu Danjuma Maternity, we've been able to, through the passion and commitment of the medical team, reach out and treat 4,827 patients with 357 babies delivered, out of which 60 of those were CS deliveries.
As the hospital come for Takum, we dey hear story about it. Then I said, let me come antenatal for the hospital.
We see a lot of complicated cases being mismanaged either from the peripheral facilities or from SHU or people that are not well trained. But over time, we start seeing the change in trend.
Ngunjini bikulabam sena sanzum fo sanzum kere o benum sanzum balajinzu fa saba ba ngunji shige sa shimpi bigeni before sanzum balajinzu benum num yata bikulabam kere.
My wife, her head has been delivered. So I was surprised because I know the pregnancy is not yet for her to be, for her to give birth to a baby. I look at the baby, I don't even know where the baby was. Because the baby was so tiny that I cannot even describe. It's a thing of joy to me.
The day of my delivery, I went there around 1:30 and I delivered my baby by 2 o'clock without any problem. Without voila.
Presently, I can say categorically, we have not recorded any maternal mortality up to date.
Guyana da na haifa a Rufkatu Maternity on 3 January a wurin na haife ta. Mana ji daɗi inda suka rike na a wurin. Sun bani kula, sun lura da ni sosai a wurin. Wallahi, na ji daɗi sosai.
Staff and Development Africa that are helping to run the clinic have done a wonderful job, and I'm very grateful.
I want to thank General Tiwe and the people where they work for hospital. Thank you. I thank him well. If not, I don't know how this pregnant will affect me.
We pray that God gives him more health, prolong his life.
We, the elder of Takum, we are thanking you for what you have done to us.
Na gode ma TY Foundation.
Thank you, Danjuma Foundation.